Hi, welcome to our channel of IGNOU Audiobooks, Indira Gandhi National Open University, School of Health Sciences, SOHS, Certificate Programs. Certificate in General Duty Assistance, CGDA. BHT001 Foundations of General Duty Assistance. Block-1 Introduction to Healthcare Services Unit 1 Healthcare System in India. 1.0 Introduction. You must be aware that every government all over the world is responsible for providing healthcare services to the citizen of their country. Same stands true for India also. Government tries to provide quality, accessible, affordable health services to all people. Therefore, it is important for you to learn about health system in India. Thus, in this unit you will learn about health system, health planning and health care delivery system in India. You will be able to describe the key elements of nation health mission and sustainable development goals. You will also be able to describe the various health problems in country and various national health programs, including activities under these programs to provide health care services to people, role of community in planning, implementation and monitoring the health care services. Let us first go through the objectives of the unit. 1.1 Objectives. After completion of this unit, you will be able to describe the health planning and health system in India, explain the healthcare delivery system in India, enlist the key elements of National Health Mission and other initiatives of COE, discuss health status and health problems, enumerate the key services in important national health programs, and describe the concept of community participation. 1.2 Introduction to Health System in India. You must have studied in your school some basic concepts about health. Let us first review the definition of the term health. Health as per World Health Organization, WHO, is state of complete physical, mental, social and spiritual well-being and not merely absence of disease or infirmity. Health is considered as a fundamental right and is a part of socio-economic planning of a country. Health is a dynamic condition, i.e., it is a changing process. Person is healthy, work normally and is productive. On other hand, can be sick at any point of time. Therefore needs health services when healthy or is sick. Hence, let us learn about healthcare planning and health system in India. 1.2.1 Health planning. Let us ask to ourselves one question: do we plan your activities in life? Yes, you will all agree that all of us plan our daily routine or monthly activities or plan for the future. Same way government also plan for the people in the country. It is important to plan because we set objectives to achieve. To achieve these objectives, some activities are planned for specific time period depending on the available resources, i.e., material, man and money, so that limited resources are used efficiently with no wastage, and best possible solutions are carried out to achieve the objectives. At the same time, feedback is taken and replanning is done if needed. Same way Government of India also plan for the country, i.e., 5-year plans are drafted. Each sector like health, agriculture, industry, education, etc. get importance in plan document. Let us concentrate on health planning. In India, purpose of health planning is for quality health care services provided through various national health programs and various schemes. National health planning is done keeping in view the priorities based on the health status, health problems and resources available, set achievable goals with timeline, and actions are planned through various programs. Day-to-day monitoring is done to see what was planned is implemented. If any problems, they are taken care of, and evaluation is done to see that goals are achieved, if not achieved reasons for and then again future planning or replanning is carried out. Health planning in India is a part of socio-economic planning for the country and is based on the recommendations of various committees set by Government of India. Various other committees set up by Government of India, GOI, are given below, which were set up from time to time. 1. Health Survey and Planning Committee, also known as Mudaliar Committee, 1962. 2. Chana Committee, 1963. 3. Mukherjee Committee, 1965. 4. Mukherjee Committee, 1966. 5. Jhunjhunwala Committee, 1967. 6. Kartar Singh Committee, 1973. 7. Srivastav Committee, 1975. 8. Bajaj Committee, 1986. In case interested, these reports can be accessed at www.nihfw.org. Some of the policy documents are: 1. Alma-Ata Declaration, Health for All by 2000 AD, 1981. 2. First National Health Policy, 1983. 3. First National Population Policy, 2000. 4. National Health Policy, 2002. 5. Second National Health Policy, 2002. 6. National Rural Health Mission, 2005. 7. National Urban Health Mission, 2013. 8. National Health Mission, 2013. 9. Revised National Health Policy, 2017. Above documents are available at www.mohfw.gov in case interested to learn about them in detail. 1. Point to health system in India. Hope all of you have studied about the Constitution of India in your school. In our Constitution, it is mentioned that health is a responsibility of state. Every state has its own healthcare delivery system. Therefore, the center plays the role in policy making, planning, coordinating, assisting, monitoring, and evaluation. State plays role in delivery of healthcare and implementation of national health programs and schemes. Let us now see the health system in India at center, state, and district levels. At the center there are A. The Central Council of Health and Family Welfare. B. The Ministry of Health and Family Welfare, Mohanfu. C. The Directorate General of Health Services, DGHS, and let us view the structure of the Ministry of Health and Family Welfare. A. The Central Council for Health and Family Welfare. There is a Central Council of Health and Family Welfare under the chairmanship of the Minister for Health and FW, comprising the health ministers of state governments, UTs, MPs, non-officials representing health organizations and public bodies, and certain eminent individuals. It is the apex policy formulating body in the field of health and family welfare for recommending broad lines of policy to the center and the states. B. The Ministry of Health and Family Welfare, MOHFW, is headed by the Union Minister of Health and Family Welfare. MOHFW has two departments. 1. Department of Health and Family Welfare, headed by the Secretary. 2. GOI, Secretary is executive head and is assisted by the joint and deputy secretaries and administrative staff. It has various departments under it like Central Health Services, Mental Health Division, Medical Education, National Health Programs, National Health Mission, Training Division, Nursing, Allied Health Services, Drug Food Quality Control, etc. 2. Department of Research. Department of Health Research, DHR, was created as a separate department within the Ministry of Health and Family on 17 September 2007. The aim of the DHR is to bring modern health technologies to the people through research and innovations related to diagnosis, treatment methods, and vaccines for prevention, to translate them into products and processes and introduce these innovations into public health system. The department is headed by secretary with an additional secretary and one joint secretary. C. The Directorate General of Health Services, DGHS. The Directorate General of Health Services, DTE. GHS is a repository of technical knowledge concerning public health, medical education, and health care. It is an attached organization of the Ministry of Health and Family Welfare. The DTE GHS is headed by Director General of Health Services, DGHS, an officer of Central Health Services, who is in technical advice on all medical and public health matters to Ministry of Health and Family Welfare. The Directorate coordinates with the health directorates of all states UTs for implementation of various national health programs. The DTE GHS oversees the functioning of central government hospitals and their management. The broad responsibility of Directorate General of Health Services are to formulate evidence-based policies and strategies and to plan and implement programs to address social and cultural determinants to ensure every citizen has the right to health and well-being, guarantee food security to provide essential nutrition, especially for mother and child, ensure potable water, sanitation facilities, and proper housing, to provide technical support to the Department of Health and Family Welfare in developing the strategies for free universal health care, to take effective measures to prevent, mitigate, and eliminate, eradicate communicable diseases of public health importance and health emergencies, to promote health through behavioral change with involvement of community to address issues related to non-communicable diseases, alcoholism, and other substance abuse, to ensure emergency medical services coverage for all, address climate change issues impacting health, lay down specific standards and norms for safety and quality assurance of all aspects of healthcare, to develop and ensure availability of human resources in health sector, to manage health information, to monitor progress and evaluate health outcome impact of health services, to provide technical guidance and advice to the state health departments. At the state level, the state is responsible for all the health matters in the state as per Constitution of India. Every state has its own organizational structure, but mainly consists of the following. A. The State Ministry of Health. B. The State Health Directorate. A. The State Ministry of Health. The State Ministry of Health and Family Welfare is headed a political head i.e. by the Minister of Health and Family Welfare, and in some states there is provision for Deputy Minister of Health and Family Welfare and Minister of Hand FW are also responsible for other departments. The Health Secretariat is headed by Principal Secretary or Secretary. Health and Family Welfare as an executive head, assisted by additional joint deputy secretaries and administrative staff. Health Secretariat is responsible for policy issues, planning, evaluation of health services in the state. B. The State Health Directorate. The Director, Health Services, DHS, also known as Director, Health and Family Welfare, is a technical advisor to the State Health Ministry on matters related to medical and public health. The designation of Director, Health Services varies in many states. In few states there are more than one directorate, i.e., Directorate of Health, Directorate of Family Welfare, Director Medical Education or Directorate of Medical and Health Services. DHS is assisted by additional or Deputy or Assistant Director, Health Services. DHS is responsible for implementation of all the policies and programs day-to-day supervision, monitoring of services at the district level. In India, district is an administrative unit headed by a district collector. Administrative areas under district are in rural area, sub-districts, tehsils, community development blocks, unit for planning and development, nearly 100 villages and 80,000 to 1,20,000 population, villages and panchayats. In urban area are town area committees, municipal boards, corporations. Each block has 4 to 5 PHCs, primary health centers, to provide health care for each 30,000 population. At district level, health sector is headed by the chief medical officer with 2 or 3 deputy chief medical officers. The district hospital functions at this level for healthcare delivery. Each state have their one set up for healthcare delivery system. 4. State organization structure need to access the specific state health website, e.g. For Haryana state www.haryana health nic in or e Delhi health nic in. Hope you can now describe the health planning and health system in India. 1.3 Healthcare delivery system in India. Let us now learn about healthcare delivery system in India. The challenges faced by country is to provide quality, accessible, affordable need-based basic health care to all the people in the country, especially the poor, tribal and vulnerable groups, mother, child, elderly and special group, etc. Various strategies and models were adopted by the country to provide health care services to people. Let us first discuss about universal health coverage, sustainable development goals and national health mission. 1.3.1 Universal health coverage. Let us learn about the concept of universal health coverage, UHC. Universal health coverage. Universal coverage refers to where everyone is covered for basic healthcare services, regardless of their socio-economic cultural backgrounds, so that all will have the right to affordable, acceptable, accountable and appropriate health services of assured quality. They receive promotive, preventive, curative and rehabilitative services at primary, secondary and tertiary levels. The primary level care is provided through the PHC and the secondary level health care is rendered by the district health system. As mentioned the 1.2 earlier, as well as addressing the determinants of health like education, nutrition, water, agriculture, etc. Today the role of a government being as an enabler and guarantor of health care services. Therefore, supplementary system of finance protection for people is also planned so that people are able to afford health care services. Principles of UHC. Universality, caring all for all health problems. Equity, equitable consideration for all. Non-exclusion and non-discrimination, no one is spared, irrespective of social or economic status. Comprehensive care of good quality, a care that is care in totality and good in quality. Financial protection at a low cost. Protection of patient's rights, survival of the patient is main motto and he gets all cares as a right to health. Strengthening public health provisioning, making all the public health faculties functional with resources. Accountability and transparency, putting everything in clarity. Community participation, taking everybody, community, along with the system, putting health in people's hand, making healthcare availability and utilization as a movement of the people, not only the government. Various initiatives taken by Government of India are the National Health Mission, National Rural Health Mission, and National Urban Health Mission aims to provide universal access to health care. Ayushman Bharat Pradhan Mantri Jan Arogya Yojana (PMJ) is a national health protection scheme aims to provide coverage up to 5 lakhs rupees per family per year for secondary and tertiary care hospitalization. Mission Indradhanush aims to increase full immunization coverage. A number of nation health programs are implemented like revised National Tuberculosis Control Program, National Leprosy Eradication Program, National Mental Health Program, National Program for Control of Blindness, National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Diseases and Stroke. It is now important to review the vision, core values, goals, strategies and outcomes of National Health Mission. 1.3 National Health Mission and other initiatives of Government of India. Let us describe the various initiatives by Government of India like National Health Mission, Ayushman Bharat, Mission Indradhanush and National Health Programs. A. National Health Mission. Vision of National Health Mission, NHM, states attainment of universal access to equitable, affordable and quality health care services, accountable and responsive to people's needs, with effective intersectoral convergence action to address the wider social determinants of health. This means, as explained earlier, that provide quality services to people as per their need with collaboration of other sectors like water, sanitation, nutrition, agriculture, etc. Core values of NHM: safeguard the health of poor, vulnerable and disadvantaged, and move towards a right-based approach to health through entitlements and service guarantees. Strengthen public health system as a basis for universal access and social protection against the rising cost of health care. Build environment of trust between people and providers of health care. Empower community to become active participants in the process of attainment of highest possible level of health. Institutionalize transparency and accountability in all processes and mechanisms. Improve efficiency to optimize use of available resources. Goals, strategies and outcomes. The key goal is to achieve the vision of the NHM as highlighted above. To meet the needs of the people, to build partnerships with health and related sectors, NGOs, civil societies, private sector and focus on well-being of women, children, reducing disease burden of communicable and non-communicable diseases and ensuring financial protection for the households through insurance and other schemes to reduce out-of-pocket expenses. To achieve these goals, following strategies to be adapted. Support and supplement state efforts for health system strengthening by providing financial and technical assistance. Build state and district capacity for outcome-based planning and implementation based on disease burden and performance-based funding. Enable integrated facility planning including infrastructure, human resource, drugs, etc. Create district-level knowledge center within each district hospital to provide care, skill-based training, analyze data and participate in district planning. Improve delivery of outreach services through fixed and mobile units. Strengthen subcenter and urban primary health centers for promotive, preventive, curative care and to be first point of primary health care. Prioritize achievement of universal health coverage for RMNCH plus A. Reproductive maternal newborn child health plus adolescent. Communicable and non-communicable disease programs. Expand focus from child survival to child development, 0 to 18 years. Through community, Anganwadi and school health services. Achieve the goal of safe motherhood. Focus on adolescent and their needs. Response to epidemics and surveillance. Convergence with ministries for reduction of undernutrition, 0 to 3 years. And anemia in children, adolescent and women. Empower Asha, accredited social work activist, to work as a facilitator. Strengthen village health and nutrition committees, Mahila Arogya Samitis. Strengthen behavior change communication. Enable free consultations, free drugs, free investigations, free emergency care and transport system by the hospitals. Partnership with NGOs, civil societies, and private sector. Create public health cadre and strengthen managerial capacities. Use of information communication technology, ICT, as additional strategy for program planning and monitoring. Ensure universal registration of births and deaths, including causes of death. Establish accountability by participatory community processes like JAN. Sunwai Samvads, social audit. Outcomes. To ensure equitable distribution and improve health outcomes, it is important to take care of disparity through effective planning, more financial and technical support, effective monitoring, relaxing norms, supportive supervision, and innovative strategies. Expected health outcomes in terms of target are: reduce MMR to January 1000 live births. Reduce IMR to 25 by 1000 live births. Reduce TFR to 2.1. Prevention and reduction of anemia in women aged 15 to 49 years. Prevent and reduce morbidity and mortality from communicable, non-communicable injuries and emerging diseases. Reduce household out-of-pocket expenditure on total health care expenditure. Reduce annual incidence and mortality from tuberculosis by half. Reduce prevalence of leprosy to 1 by 10,000 population and incidence to 0 in all the districts. Annual malaria incidence to be January 1000. Less than 1% microfilaria prevalence in all the districts. Kala-Azar elimination by 2015, 1 case per 10,000 population in all the blocks. B. Ayushman Bharat, Pradhan Mantri Jan Arogya Yojana. PMJ. One of the major initiatives by Government of India is Ayushman Bharat. This scheme will adopt standard treatment guidelines, defined package rates, use of information technology and data analytics. Establishment of health and wellness centers, the first component, pertains to creation of 150,000 health and wellness centers which will bring health care closer to the homes of the people. These centers will provide comprehensive primary health care, CPHC, covering both maternal and child health services and non-communicable diseases, including free essential drugs and diagnostic services. Prime Minister of India on 25th September 2018 rolled out health insurance scheme, Pradhan Mantri Jan Arogya Yojana, PMJ. It is one of the initiative under Ayushman Bharat. It is a step forward towards financing the delivery of health care for the poor. The objective is to provide health cover of 5 lakhs rupees for secondary and tertiary hospitalization per family per year. This is one of the strategy to achieve universal health coverage by improving access and affordability of secondary and tertiary care services through public and private care providers. Entitlements of PMJ include pre- and post-hospitalization expenses, Define transport allowance per hospitalization. Patient can avail services from anywhere in the country. Services from any empaneled public or private hospital. Cashless insurance. Benefits of PMJ include regulation of healthcare and accreditation of health facility. Incentivize hospitals to expand in rural areas. Package rates 15 to 20% lower than central government health scheme. Performance-based payment system. ICT use for free flow of data and tracking of transactions. Mapping of beneficiaries, track insurers, and healthcare providers. Integrating with services at health and wellness centers. Digital Information Security in Healthcare Act to protect the storage, use and transmission of patient data. Benefits reach to all. Out-of-pocket expenditure is reduced. Beneficiaries are satisfied. See Mission Indradhanush. Immunization program was introduced in India in 1978 as Expanded Program of Immunization. In 1985, program was modified as Universal Immunization Program, but approximately 65% of children were immunized in first year of life. To strengthen the program and to achieve full immunization coverage for all children and pregnant women, Government of India launched Mission Indradhanush in December 2014. The goal of Mission Indradhanush is to ensure full immunization to children up to 2 years of age and pregnant women in identified 216 high-focus districts. For intensified immunization activities, Prime Minister of India launched Intensifies Mission Indradhanush on 8 October 2017 to reach all the uncovered children up to 2 years of age and pregnant mothers under Routine Universal Immunization Program. Intensified Mission Indradhanush will cover low-performing areas. 1.3.3 Health Status and Health Problems. Health status and health problems data are an essential components to planning healthcare services. Let us think what type of data needs to be collected. So let us learn type of data any health administrator needs. Sources of data are census reports, survey reports, vital statistics, health profile of country, annual reports of states, health utilization data, etc. To analyze the health situation and defining health problems, following data are required. 1. Morbidity and mortality data. Morbidity means illness. Person can also have comorbidities, i.e., morbidity may lead to morbidity. For example, a person having diabetes might have kidney damage because of diabetes. The kidney disease is then known as comorbidity. Prevalence is used to measure the morbidity. Now you would like to know what is prevalence? Prevalence is total number of cases of a particular disease at a given period of time in a population divided by total population at that time. It is generally expressed in percentage. Another term is incidence, which means number of only new cases of a disease in a population divided by the number of persons at the risk for the disease during given period of time. It is also expressed in percentage. Mortality means death. It is number of deaths due to disease divided by total population. 2. Demographic data. Demographic data includes socio-economic like age, sex, education, income, occupation, marital status, religion, size of family, etc. 3. Environmental conditions which have impact on health. 4. Socio-economic factors like family income, per capita income and economic assets, etc. 5. Cultural factors, attitudes, beliefs, practices, etc. 6. Health services and other related services available. 7 other services available which have impact of health. If the data is analyzed from all the above sources, it will give an idea about health situation of a state or district and health problems prevalent in the area. Then health administrators can assess the health needs of the community and prioritize the health problems, allocate the resources and plan action to implement modified healthcare action. In India, major problem is the uncontrolled huge population, high fertility and high birth rate, low death rate, more young population and increasing elderly population. Every year Indian population increases to a total additional population as large as Australia. Over time, health status of people has improved and death rate is declining, and while life expectancy has increased. However, as compared to developed nations' standard of health status is low in India. Still our maternal and newborn deaths are high as compared to developed nations. Health problems. Health problems in India can be grouped as given below. 1. Non-communicable diseases in India are increasing and deaths are also increasing due to diabetes, cancer, cardiovascular, stroke, blindness, mental health and injuries, etc. 2. Communicable diseases are still public health problems like malaria, filaria, kala azar, diarrheal diseases, tuberculosis, leprosy, acute respiratory infections and HIV/AIDS, etc. 3. Nutritional problems, undernutrition, stunting, anemia, low birth weight and deficiency disorders, etc. are in rise. 4. Increase in environmental health problems due to air, water, soil pollution, environmental sanitation, and climate changes. 5. Population increase leads to problems like unemployment, high density of population in urban areas and slums, rising cost, inadequate infrastructure, low income, etc. 6. Medical care problems are issues related to housing, availability of doctors, nurses, living conditions, etc. 1.3.4 National Health Programs. Government of India initiated many national health programs to improve the health of the people. These programs are implemented by State Health Directorate. Activities are carried out by staff at district level and hospitals also implement these programs. Therefore, it is important to list the various national health programs and describe the activities under these programs. A. National Vector-Borne Disease Program, NVBDP. The Directorate of NVBDP at Center is nodal agency for policy making, technical support, planning and monitoring the program under National Health Mission, NHM. NVBDP is implemented to prevent and control various diseases like malaria, filariasis, kala-azar, Japanese encephalitis, dengue, chikungunya. These are major public health problems in India and strategies for prevention and control of diseases are early case detection and treatment, strengthening referral services, epidemic preparedness and rapid response, surveillance, integrated vector management measures like indoor residual spraying, use of insecticides, treated bed nets and care of environment, behavior change communication, intersectoral convergence, capacity building of staff, monitoring and supervision, operational research. Specific strategies for specific diseases are also suggested. Malaria. In 2016, government launched the National Framework for Malaria Elimination 2016 to 2030 with a goal to eliminate malaria throughout the country by 2030 and malaria-free status and prevent reoccurrence. The strategies under the National Framework for Malaria Elimination are Early case detection and prompt treatment. Chloroquine is the main drug. Vector control. Integrated vector management. Chemical spray, indoor residual spray, IRS, daytime spray and spray during epidemics. Personal prophylactic measures, use of mosquito repellent creams. Covering body with cloths, long-lasting insecticidal nets, LLINs. Insecticidal treated bed nets, ITNs. Environmental management and source reduction methods, filling. Breeding places, covering stored water. Community participation. O behavior change communication. O partnerships with NGOs. Monitoring and evaluation. B. National Leprosy Eradication Program, NLEP. In 1983, National Leprosy Control Program was renamed as National Leprosy Eradication Program, NLEP, with a goal to reduce case load to 1 or less than 1 per 10 O population. The program is integrated with general healthcare system in 2002 to 2003. That is why treatment is available in all the hospitals and primary health centers and urban health centers. Strengthen disability prevention and medical rehabilitation and reduction of stigma associated with leprosy. To achieve the goals, the program strategies are early detection and complete treatment of new cases. Households contact survey for early detection. Involvement of SHs in early detection and treatment. Strengthening disability prevention and medical rehabilitation, DPMR. Services. Information education and communication, IEC, activities to improve. Self-reporting and removing stigma. Monitoring and supervision. Involvement of NGOs. Capacity building. Research activities. C. Revised National Tuberculosis National Program, RNTCP. RNTCP was launched in 1997 and countrywide it was implemented by 2005, which recommended directly observed treatment short course. DOTS. In 2006, Stop TB strategy was adopted. During 2012 to 2017, National Strategic Plan for Tuberculosis Control was implemented with a goal to universal access to quality tuberculosis, TB diagnosis and treatment for all TB patients in the country. In 2012, Nikshay, a new initiative was adopted, i.e. TB surveillance using case-based web-based IT system. TB notification, i.e. every healthcare organization have to report TB cases to district health authorities. To eliminate TB by 2025, National Strategic Plan for Tuberculosis Elimination 2017 to 2025 is being formulated with 4 strategic pillars, i.e. Detect, Treat, Prevent, Build, DTPB. Various initiatives under RNTCP. Passive case finding. Sputum examination in microscopic center. Free drugs under DOTS. Daily regimen for pediatric TB cases. Daily regimen for TB HIV co-infected patients. Drug resistance surveillance, DRS. Find all drug-sensitive TB, DSTB, cases and drug-resistant, DRTB. Cases taking treatment from private sector and undiagnosed cases screening is done. Initiate and sustain all patients on free TB treatment, monitoring and social support, linking TB patients with social welfare schemes. Control airborne infections and treatment of contacts. Intersectoral approach. Partnership with NGOs and private sector. Research activities. D. National AIDS Control Program, NAC. National AIDS Program was launched in 1984 and in 2014 NAC-4 was launched providing preventive care, treatment and support services. National Strategic Plan for on HIV AIDS and STI, 2017 to 2024, with a 3 zeros goal, i.e. 0 new infections, 0 AIDS-related deaths and 0 discrimination. In 2017, India HIV/AIDS Prevention and Control Act was enacted. The strategies for prevention, testing and treatment. Increase coverage for improved prevention, testing and care linkages. Prevent HIV infection in risk population. Evidence data to locate new high-risk population groups. Using technology to reach high-risk vulnerable groups. Quality testing and treatment services. Increase ART coverage. Strengthen laboratory and blood transfusion services. Advocacy communication and social mobilization. Elimination of parent-to-child transmission of HIV and syphilis. Capacity building. Addressing stigma and discrimination. Strengthen RTI-STI prevention and control. Reproductive maternal newborn child health plus adolescent. Program, RMNCH plus A. RMNCH plus A approach was launched in 2013 with an aim to assess the causes of mortality among women and children, delay in accessing and utilizing health care services. Approach adopted was continuum of care to focus of all life stages. Goals of the program is to reduce maternal mortality rate, infant mortality rate, and total fertility rate. Various interventions under Janani Shishu Suraksha Karyakram, Janani Suraksha Yojana, Dakshata Implementation Package, Lakshya Guidelines and various other interventions are being adopted to achieve the above goals. Interventions under RMNCH plus A. Reproductive health. Focus on spacing methods. IUCD at all facilities on fixed days. Home delivery of contraceptives. Ensuring access to pregnancy kit. Strengthening comprehensive abortion services. Quality sterilization services. Maternal health. Use maternal child tracking system, MCTS, for early registration of pregnancy and full antenatal checkup, ANC. Detect high-risk pregnancies and severely anemic mothers and ensure their management. Trained manpower for delivery and access to emergency obstetric care. Review maternal and child deaths and take corrective actions. Identify villages for home delivery. Newborn health. Early initiation and exclusive breastfeeding. Home-based newborn care through ASHA. Essential newborn care, resuscitation at all delivery points. Special newborn care units. Child health. Complementary feeding, IFA supplementation. Diarrhea management at community level with ORS and zinc. Management of pneumonia. Full immunization coverage. Rashtriya Bal Swasthaya Karyakram to detect birth defects. Development delays, deficiencies and diseases and management. Adolescent health. Address issues of teenage pregnancy. Community-based services for adolescents. Provide iron and IFA supplementation. Promote menstrual hygiene. National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Diseases and Stroke, NPCDCS. Objectives. Health promotion through behavior change with involvement of community, civil society, community-based organizations, media, etc. Opportunistic screening at all levels in the healthcare delivery system. From subcenter and above for early detection of diabetes, hypertension, and common cancers. Outreach camps are also envisaged to prevent and control chronic non-communicable diseases, especially cancer, diabetes, CVDs, and stroke. To build capacity at various levels of health care for prevention, early diagnosis, treatment, IEC. BCC, Operational Research and Rehabilitation. To support for diagnosis and cost-effective treatment at primary, secondary and tertiary levels of healthcare. To support for development of database of NCDs through surveillance system and to monitor NCD morbidity and mortality and risk factors. Strategies. Health promotion, awareness generation and promotion of healthy lifestyle. Screening and early detection, timely, affordable and accurate diagnosis. Access to affordable treatment, rehabilitation. To provide all the services under national health programs and general health services, there is need for healthcare system to provide promotive, preventive, curative and rehabilitative services at primary, secondary and tertiary level. Now we will learn about healthcare system in India. 1.3. 5. Healthcare system. Let us first understand the levels of healthcare. Levels of healthcare. Healthcare is provided at 3 levels. Type of care and institutions varies at each level. Indian Public Health Standards, IPHs, are followed for infrastructure, human resource, equipment, supplies and services provided at each level by various institutions. 1. Primary level care. It is a first level of contact between people or community with health care system. It provides basic need-based health care PR essential health care to people. Primary health care is provided by subcenters, SCs, and primary health centers, PHCs, through ASHs. Multipurpose health workers, female and male, also known as ANMs at some places or different states designate them by different names: Anganwadi workers, local healers or traditional health care workers, RMPs and many OTE voluntary organizations or non-government organizations, NGOs. 2. Secondary level care. It is a first referral unit where PHC refer the patients for further treatment. Community health centers, CHC, and district hospitals provide care to people. 3. Tertiary level care. It is a specialized referral units where care is provided by the specialists through regional institutions, national institutions, and tertiary hospitals with or without attached medical colleges. Healthcare system in India. Let us now proceed to learn about healthcare system under public or government sector, private sector, indigenous system and voluntary sector, which provide healthcare services at all level. A. Public or government sector. Primary level, subcenters and primary health centers. Secondary level, community health centers, block hospital and district hospital. Tertiary level, secondary 200-bedded hospitals, specialized hospitals, teaching hospitals. Health insurance schemes, central government health scheme. CGHS, employee state insurance, ESI, railway and defense. Institutions provide services to their employees and their families. B. Private sector. Private large and small hospitals, nursing homes, polyclinics, dispensaries, private practitioners' clinics. C. Ayush system, Ayurveda, yoga and naturopathy, Unnani, Siddha and homeopathy. Hospitals, dispensaries, private practitioners' clinics. D. Voluntary organizations and non-government organizations. NGOs. Various voluntary health agencies and NGOs provide health care services. E. Others. Local healers, untrained practitioners, registered medical practitioners. RMPs, to provide health care services to local people. In brief, we have learnt about healthcare agencies which provide services to people. As we have discussed earlier, that community participation is very important for planning, implementing and monitoring healthcare services at community level. We will now learn about concept of community participation. 1.3 6. Community participation. Community participation is important for planning, implementation and monitoring of healthcare services, and it is the responsibility of the community in order to take care of the health of the community itself. It is believed by the health administrators must aim at the involvement of community is essential to provide primary health care services and to achieve universal health access. It is important to utilize local resources, such human resource, material and money. Since beginning health guides, trained days, local health workers, multipurpose health workers A&M, Anganwadi workers and SHs are involved in providing health care services to people from the community. Even under National Health Mission is it envisaged that active participation of community is very important, and examples are involvement of ASHA, formation of Village Health and Nutrition Committee, VHSNC, involvement of NGOs and public participation in facility-based committees.
Participation does not end in utilizing the human resources. The community should participate in planning and implementation of healthcare delivery also. The administrative leadership capacity is being enhanced by different managerial training programs of the health sector administrators like CMO, Deputy CMO and medical officers. The block extension educator is also being converted as community health managers. 1.4 Summary. In this unit you have learned about the health system in India, i.e. health planning process in India, list of various committees which were set up by the Government of India and their recommendations were taken into consideration while planning health system structure in India at center, state and district level, and their functions were described in brief. Center is responsible for policy, planning and technical assistance. State implement and supervise the health policies and programs, and district and implementation unit at field level. Further, healthcare delivery system was explained with emphasis on universal health coverage, i.e. every citizen is covered for healthcare services irrespective of socio-economic status, and services are accessible, available and affordable. National Rural Health Mission was launched in 2005 and National Urban Health Mission was launched in 2013, therefore to converge the both in 2013 National Health Mission was announced. Emphasis was given on to meet the needs of the people, to build partnerships with health and related sectors, NGOs, civil societies, private sector, and focus on well-being of women, children, reducing disease burden of communicable and non-communicable diseases, and ensuring financial protection for the households through insurance and other schemes to reduce out-of-pocket expenses. Further health problems were listed and important national health programs, strategies and interventions under these programs were listed. Healthcare is provided at 3 levels, type of care and institutions varies at each level. Healthcare services are provided by healthcare system through public or government sector, sub-centers, primary health centers, community health centers, block and district hospitals, secondary, tertiary hospitals which are specialized or teaching hospitals. Private sector is also providing health care services to people through dispensaries, polyclinics, small and large nursing home, small and large hospitals. Unit 2 of this block will discuss hospital on an organization. Thank you, subscribe to our channel for more updates, and we will see you with the next